everyone, welcome to my YouTube channel. In this video, we are going to study about dermatophytosis. Okay, so dermatophytosis is the most common type of skin infection or the cutaneous fungal infection which involves skin, hair, and nails. Okay, so basically, these dermatophytes, what we call, infect skin, hair, and nails. Okay, so they are caused by group of fungi. Okay, so there are mainly three group of fungi or the three species of fungi which causes the dermatophytosis. Okay, so they are collectively known as dermatophytes, and the common name is tinea or ringworm infection. Okay, so coming to the classification, we have three genera, that is genus Trichophyton, Microsporum, and Epidermophyton. Trichophyton infect hair, skin, and nails. Microsporum infect hair and skin, and Epidermophyton infect skin and nails. Okay, so these are the three genera which collectively causes the dermatophytosis. Okay, so coming to the important species, Trichophyton has four medically important species, that is Trichophyton rubrum, Trichophyton mentogrophyte, Trichophyton torserens, and Trichophyton verrucosum. Okay, and Microsporum, if you come, you have Microsporum gypsum, Microsporum canis, and Microsporum odoni. Okay, coming to Epidermophyton, you have Epidermophyton flocosum, which is most commonly isolated or medically important species of Epidermophyton. Coming to the pathogenesis, we have different variety of infection caused by the dermatophytes. So we, in common name, we call it as tinea or ringworm infection. Okay, so tinea capitis, that is the infection of the scalp. Okay, then we have tinea corporis, which involves the glabrous region or non-hairy skin of the body, and we have tinea crucis, infection of groin region, and generally or most frequently is like common infection is athlete's foot or tinea pedis, so which is commonly we can see in the athletes. Okay, so causes the infection in the web spaces. Okay, tinea barbae, or we call it as barber's itch, the infection of the beard area. Okay, so most commonly we can see in the men. Okay, so these are the different clinical condition caused by the tinea or the dermatophytes. Okay, skin infection, then tinea capitis, that is scalp infection. We have athlete's foot, barber's itch. Okay, so this, based on the infection or the penetration, we classify this infection to two types, ectothrix and endothrix. Okay, so ectothrix means arthrospore are present on the surface of the hair shaft. Okay, arthrospores are the spores produced by the dermatophytes. So if it is present only on the surface of the hair shaft, then we call it as ectothrix. If it is entirely within the or it invasive in the hair shaft, then we call it as endothrix. Okay, coming to the laboratory diagnosis, we'll take skin scraping in case of skin infection. We take hair sample in case of hair infection, and nail clipping in case of nail infection. Okay, so generally we use a 10% KOH mount to visualize the fungal hyphae. From the direct sample, we'll do KOH mount, and we culture on SDA with or without antibiotics, and we incubate it room temperature for maximum of 3 weeks. Okay, so it is a little bit slow grower, so we have to incubate for at least 3 weeks to say at, like if it is not grown, we say it as negative, we have to wait till 3 weeks. Okay, so we can identify by pigment production. We can see microconidia and macroconidia while we do the LPCB mount. Okay, so we do LPCB mount, that is lactophenol cotton blue. We can see different arrangement of the macro and microconidia. You can see here microconidia are abundant in Trichophyton, macroconidia are little less, and this is microsporum. We have macroconidia here more, and we have epidermophyton. Okay, coming to the molecular diagnosis, we do PCR, and Wood's lamp examination generally done by the dermatologist. Okay, for the treatment we'll use